Welcome, everyone. I am Cindy Klement. I have been in the health field, I should say. Hold on here. Got to get everything organized. All right, well, we'll try that again. I've been in the health field since about 1978. I began as an herbalist, and then I went on to get my master's degree in clinical nutrition. I've also been an adjunct professor for the last 10 years at a Michigan university. I teach the graduate level course, Functional and Integrative Medicine. I've taught for over 43 years now, continuously, and educating others is one of the very true passions that I have, as well as being a grandmother. So thank you for joining us this evening. Our friend Craig Daly is not going to be with us this evening for our webinar on omega-3 fatty acids because he's celebrating his wedding anniversary with his lovely wife. So congratulations to you and you, Craig and Lisa. So let's get started on the presentation. What makes omega-3 fatty acids special? Well, they are an integral part of the cell membranes throughout our bodies, and they actually affect the functioning of the cell receptors on those cell membranes. And because of these effects, omega-3 fatty acids have been shown to prevent heart disease and stroke. They have been shown to help control lupus, eczema, rheumatoid arthritis, reduce inflammation, and can even play a protective role in cancer and other chronic disease conditions. Omega-3 fatty acids, they provide the starting point for making hormones in our bodies that help to regulate our blood clotting, the contraction and the relaxation of our artery walls. And these fatty acids also regulate the immune system as well as our central nervous system. They also bind to the receptors in cells that regulate our genetic functioning. So I'm sure you've heard the term of turning on genes. We all have bad genes in our body. And what we want to do is keep those bad genes turned off. So one of the worst genes I have, because I was actually in a study called Genes for Good through the University of Michigan, and I have my complete DNA. And really, the only bad thing that I really have in my body, I'm very blessed, but it's macular degeneration. And according to the DNA, I have a 25% greater chance, that's a huge number, of developing macular degeneration later on in life. And so knowing that, and knowing that I don't want to turn on that disease gene, I do everything I can, such as omega-3 fatty acids and antioxidants and so many other things, to keep that DNA from getting turned on. So when we talk about these omega-3 fatty acids and talk about how they bind to the receptors in the cells that regulate the genetic function, that's really an important role. But omegas are also really important for our brain health, as well as the development in our bodies, normal growth, normal brain development. And this is one of the reasons why pregnant women are urged to consume foods that are high in omega-3 fatty acids. In fact, studies have shown that increasing the intake of certain essential fatty acids, especially the omega-3s, can increase our health and help alleviate disease. They can help improve our body composition. So, how much fat and muscle we have, our mental and physical performances, as well as our energy production. So this is what makes these essential fatty acids so vitally important to human health. Now, there are two types of fatty acids. One is essential fatty acids, and the other is a non-essential fatty acid. Now, the body can create the non-essential fatty acids, and how they do so is by converting amino acids in the foods that we eat, converting those aminos to non-essential fatty acids. But the term essential is used to signify the body's inability to produce that type of fatty acids. So these omega-3 fatty acids are considered essential because we cannot make them as humans. And so thus, their consumption is required from dietary sources in order to meet those biological demands. Now, eicosapentaenoic acid, or EPA, and doxahexaenoic acid, the DHA, they're in some foods, but mainly they come from fish. So they are sometimes referred to as the marine omegas. While EPA has this anti-inflammatory effect, DHA is known to boost that brain health. Now, what I want you to know is that these two fatty acids can be made in the body through the consumption of alpha-linolenic acid, foods high in alpha-linolenic acid. And why ALA, alpha-linolenic acid, is so important is that it's naturally found in plants, in plant oils, especially leafy greens. Now, I'd like to use the acronym ALA through the presentation, but I want to explain that there might be some confusion with that acronym ALA, because alpha lipoic acid is also referred to as ALA, but alpha lipoic acid is actually an antioxidant. And this is something that's naturally made in the body and found in food. And it's used to break down carbohydrates and to help us make energy. Linoleic acid is what's known as an omega-6 fatty acid, whereas the alpha linoleic acid is an omega-3 fatty acid. And as I've mentioned, it occurs naturally in plant oils. Now, these omegas, these omega-3s and 6s and 9s, they have to be in balance to maintain our optimal health. And it's not that omega-3s are good and omega-6s or 9s are bad. We need all of them. But in most Western diets, omega-6 fatty acids are typically consumed in 5 to 20 times greater amounts than the omega-3s because we don't eat enough plant foods in this Western diet. So I mentioned that we need both, and it's the omega-6 fatty acids that promote heart health, but when not balanced with those omega-3s, they can increase our immune response and increase inflammation in the body and increase blood pressure. So because the 6s and the 9s produce these opposite effects, our goal then is to try and balance them in our diet by getting more of those omega-3s. Now, ALA, as I mentioned before, is a precursor to EPA and DHA. And a precursor is just a substance from which another substance is formed, especially through a metabolic reaction. So ALA is the key component of all cell membranes in our body. And in this conversion process to EPA or DHA, if it's not fully converted, it's really not a problem. It's simply stored in the body and used as energy, like some of the other fats. Now, as I mentioned before, EPA and the DHA mainly come from fish, and thus we have the name the marine omega-3s. But there's two problems with that, and one is that our oceans are being depleted of fish. In fact, they say that by I think it's the year 2030 or 2050, I can't remember. I think it's 2050. There will be more plastic in the ocean than fish. So we're eating a lot of fish because we know it's good for us, but the oceans aren't regenerating like they should. So to me, that's a problem for them to take all these fish out of the ocean just to make fish oil supplements. I have a problem with that. But the other problem is that some species of fish may contain significant levels of methylmercury and PCBs and other environmental contaminants. So in general, the larger the predatory fish tends to contain the highest level of these contaminants. Now, if you remove the skin and the fat and the internal organs of the fish, prior to cooking, and you also allow the fat to drain from the fish while it cooks, this will decrease the exposure to a number of those fat-soluble pollutants, such as PCBs. However, the methylmercury is found throughout the muscle of the fish, the flesh of the fish. So these cooking precautions aren't going to reduce the exposure to methylmercury. So as we know, these mercury compounds are toxic, and these excessive exposures can cause brain and kidney damage, so much so that the developing fetus, the infants and the young children, are especially vulnerable to the toxic effects of mercury in the brain. And in order to limit their exposure, the FDA and the Environmental Protection Agency suggest that women of childbearing age who are pregnant or breastfeeding should not even consume fish, nor should children under the age of 6. So personally, I like to get my omegas from the plant world just to avoid all that other nonsense. Let's go back to these omega-3 plant oils such as alpha-linolenic acid. Again, our bodies generally use ALA for energy, and then that conversion to EPA and DHA. And some studies suggest that there's a possible link between ALA and the lower incidence of cardiovascular disease, as well as certain cancers. And it can also help with symptoms of rheumatoid arthritis, as well as inflammatory bowel disorders. Now, there's preliminary research, so stuff that has to be looked at a little bit more, but the preliminary research is suggesting that ALA can decrease inflammation, which keeps us from turning on those diseased DNAs that we have. That ALA can improve lung functioning in people with asthma, as well as show improvement in dry eye conditions. That the ALA is even comparable to corticosteroid use for these dry eyes. ALA is also linked with lower inflammatory markers among patients who have chronic obstructive pulmonary disease. You've probably heard of COPD. And then other studies show that ALA has cardioprotective effects. So, for instance, in cultures where a high consumption of foods rich in omega-3s occurs, these cultures, these people show a lower incidence of dementia. So EFAs are essential fatty acids, I call them EFAs. Essential fatty acids may also have a protective effect against future dementia and things like that. So the deficits of omega-3 fatty acids result in a variety of different health problems. And there are clinical signs of essential fatty acid deficiencies, which include like a dry, skilly rash, or a decreased growth in infants and children, and increased susceptibility to infection, as well as poor wound healing, as well as issues with hair and nail and skin, or even dandruff, or that infant cradle cap that they get. We mentioned the dry eyes, but also a dry mouth or a dry throat. Another deficiency symptom would be excessive earwax or excessive thirst in the body. Inadequate vaginal lubrication can be a sign, or menstrual cramps, or premenstrual breast tenderness or pain can be a symptom of a deficiency, as well as a person that's craving fats and fatty foods. Think about it. That's your body's way of saying, eat more of the good fats, but what do they turn to? They turn to the fried foods and things like that most often. Another symptom of an omega-3 fatty acid deficiency could be stiff or painful joints. So there's all kinds of things that omega-3 can help with in our bodies. So the strongest evidence for the beneficial effects of ALA has to do with heart disease. And ALA, it appears to help the heartbeat at a really steady clip, which is great. And one small study found that women who ate high levels of foods containing ALA had a 46% lower risk of sudden cardiac death. That's impressive, 46%. And then there were other population studies that showed that people who ate more foods containing ALA, heart disease deaths went down in general, with still other studies finding that a diet rich in ALA reduced the risk of high blood pressure by about 30%. ALA can also help improve the blood vessel functioning, which of course is going to play a role in preventing atherosclerosis. So how ALA does this, protects us against cardiovascular disease, is by altering the omega-3 content of our cell membranes, and thus improving our blood lipids and that endothelial functioning. Now, I've talked about those endothelial cells before. What they are, they're these little tiny cells that line all of our hollow organs, the stomach, the intestine, the blood vessels, the arteries. So these are very tiny cells, and you want to keep those cells really happy so that, especially in the cardiovascular system, and they're very susceptible to inflammation. So if we can use omega-3 fatty acids to keep the inflammation down, so be it, as they say. Other benefits of ALA consumption are a reduced risk of blood clotting, because omega-3 fatty acids prevent the blood platelets from clumping together. Other benefits include keeping the lining of those arteries smooth and free of damage that can lead to these thick, hardened arteries, and also helps when you keep them smooth like that, keeps the plaque from forming in the arteries. Other benefits, cardiovascular benefits, include lowering the triglyceride levels by slowing the rate that they form in the liver. Of course, reducing inflammation, which omega-3s and ALA can slow the production of substances that are released during this inflammatory response in the body. And lastly, by raising what we call the high density lipoprotein, or the HDL, the good cholesterol. So you can see how ALA is just really so beneficial for our bodies. Now, essential fatty acids are also critical, and I mentioned a little bit about this, to the brain and nervous system. And this is, I think, a startling fact that essential fatty acids represent anywhere from 15 to 30% of the dry weight of our brains, and the average adult brain weighs about 3 pounds. So when you think that about 1/2 to almost 1 pound of our brain could be essential fatty acids, well, that's a good reason right there to make sure we get them in our diet. The researchers have shown that essential fatty acids, especially the omega-3s, can be beneficial in easing the symptoms of bipolar disorder, depression, ADHD, as well as psychosis. Now, of course, depression and anxiety are two of the most common mental disorders in the world. But what the researchers found is that when people consume omega-3 fatty acids regularly, they're less likely to be depressed or anxious. And when people already with depression and anxiety start getting more of these omega-3s in their diet, their symptoms tend to improve. So ALA is found in many different plants, including kale and spinach, chia seeds, flax seeds, hemp seeds, things like that. And in plants alone, the ALA comprises about 50% of all the fatty acids in those green leafy plants. And this is because ALA is a key component of plant cell membranes, and thus our cell membranes. The content of hemp seed oil is about 80%. So it's an exceptionally rich source of ALA. And then the ALA content of flax seeds is about 45 to 55%. So again, what a wonderful way to get this beautiful omega-3 into our body through plant sources and not have to worry about depleting the oceans and getting all these contaminants in the fish that we're eating. So how do we obtain ALA from Touchstone Essentials product line? Well, if you use these 4 products on a daily basis, you don't even have to think about it anymore, because flax is found in the organic super protein, in the super green juice, as well as in wellspring. Hemp is in the organic super protein. Kale can be found in super green juice. Spinach also is in super green juice, but it's also found in super greens plus D, whereas chia is found in super green juice as well as the organic super protein. So folks, this concludes tonight's presentation. I know it was a little on the short side. What I wanted to do is I wanted to make a longer not longer. I wanted to make a presentation that talked about the importance of omega-3 fatty acids, enzymes, and fiber, kind of put it all together. But the presentation got so long that I just kind of chopped off the omega-3 portion. And so on July 28th, I hope you'll join us, and we're going to go over the importance of enzymes and fiber. So that one's going to be a little bit longer. So just kind of know that and mark your calendars accordingly. So thank you so much for joining us tonight. Have a wonderful rest of your evening, and we'll see you in a couple of weeks. Good night.